Just so everybody knows, we are recording. All right, we just give it another few seconds here. And I like to be a stickler and start on time. All right, it's well, 8 a.m. Mountain Standard Time where I am right now. I'd like to welcome everybody to our inaugural session of the IFPO Global Webinar Series. We're based out of Canada, but that certainly doesn't mean that it's limited geographically. We welcome people from all over the world. And I just want to put a shout out to the IFPO UK, who are also launching their webinars in January 27th, actually, with their first webinar scheduled next Wednesday. So just a bit of a preamble here, just launching here now, January 20th, 2021, International Foundation for Protection Officers is going to host a series of monthly webinars on a variety of topics relevant to today's frontline security practitioners, and designed for those in officer and supervisory roles. These webinars will provide information on a variety of topics designed to give you the tools to increase your effectiveness, build your skill set, and help you with your security career. So each session is going to be short, just 30 minutes long. And we start at 10 a.m. Eastern time on the third Wednesday of every month. And these sessions are either going to be a host presentation or host and panelists, and we're going to discuss a variety of topics. So I just want to remind everybody that there is a Q&A function, as well as the attendee discussion feature where people can post comments for other people to see. And so here we are in session one, and the challenges and opportunities of providing security during COVID-19. And providing uniform security services created both challenges and opportunities during the pandemic. As we all know, the pandemic and resulting restrictions and lockdown in effect across the world has taken an incredible toll on frontline security personnel. The impact on them initially led to the reduction of staff in some sectors, such as special events, retail, colleges and universities. Sites were either closed or reduced services. On the other side, though, there's been an explosion of security personnel required for access control, rule enforcement, and overall protection of assets. So given that security staff are truly front line and first responders, as you know, it's becoming more and more common, as they are often the ones who call emergency services, this has exposed them to increased levels of risk to the pandemic. Couple of different stats I just want to quote. One is from the Office of National Statistics in the United Kingdom. Male security guards have the highest rate of coronavirus deaths in the United Kingdom, with 74 deaths per 100,000. In the United States, 259 officers have died from contracting the virus in 2020, and unfortunately, first couple of weeks of 2021. So obviously very sad. There's no doubt there are similar issues with security personnel around the world. In addition to COVID exposure, there's been an explosion in violence where security personnel are expected to enforce rules and have taken the brunt of the pushback from the public who refuse to wear masks and follow other rules. So starting this, I want to introduce my two guests, starting with Parnell, who will introduce himself. So Parnell.
I'm Parnell Lee. I'm the Director in Security Life Safety for Brookfield in Calgary. We have about 8 million square feet in high-rise office properties, and we employ just over 100 security guards.
Jason.
Thanks, Glenn. Good morning. My name is Jason Gibbon. I'm with Cadillac Fairview. I'm the Security and Life Safety Manager for Rideau Centre in downtown Ottawa, Ontario. We have security staff. We have about 25 here, and I've been in the industry for about 20 years.
Thanks, Jason. And before I ask Parnell for his opening statement, I just want to remind the audience that if you do have questions, please ask them. You can put them in through the Q&A section. You can see the menu along the horizontal menu along the bottom of the board. So we're just going to go back to Parnell for his opening statement, please.
Perfect. Security has been on the front lines since day one. So the recognition for the guard staff, though, has been missed when you compare it to the recognition that is given to grocery clerks and pharmacists. This is not new to COVID-19 and is more an expected requirement of guards that gets overlooked. Enforcement has been something that the general population wants. In a lot of cases, security is being asked to address this. The issue is this puts the guards in harm's way, as things like wearing a mask can bring out a lot of emotions in people. Having a strong training plan for your staff on their expectations and addressing these types of requests is very important. Guards are just as confused by the pace of change happening through COVID-19 as everyone else is. When you look at COVID-19, how many of us had a pandemic plans prior to the event, and now you see a lot of things that were missing in those plans. This has created opportunities to relook at how we manage our guard staff. And for instance, if you have one guard get sick on a shift, you could lose an entire shift. This has allowed us to see where things are working well, but also to adjust where needed. We have a better understanding now how fear that comes into the event of this magnitude. This can impact guard staff who are exposed on patrol and in key rooms, etc. How do we manage that fear, plus look after their safety so they can be successful at their job? Who could have expected that we'd be in this situation for almost a year? How many people could have predicted COVID-19 fatigue from staff? We were also found that no planning was being done to address the vulnerable population. And this problem became a security issue that we had to deal with. Increased negative reactions and threats to the guard staff made us rethink response and created a need for additional training to address this. Hiring for these front line roles also has been an issue. And we're seeing a lot of that because of the issues that we're dealing with on a day-to-day basis, and being on front line, people don't want to go into that role. So we're having issues with hiring. So is there a risk that some of the traditional roles in security, guards on patrol, will become automated? This is being seen in other industries where there's failure for companies, the primary failures for companies is what is found to be people. That's it for me. Thank you.
Thanks, Parnell. Jason.
Thanks, Glenn, and thanks, Parnell. As Parnell had mentioned, security's been right on the front, literally right on the front line since the beginning of the pandemic. And just to back him up, it gets overlooked very, very quickly and very easily. A lot of people just forget that security are the ones that are on the front line and dealing, being the first responders on that. Being a large shopping mall in a downtown setting, we're 1.5 million square feet right in the middle of downtown Ottawa. Our experiences are different from a high-rise environment. Our interactions are predominantly with the public, less with tenants. And with the lockdowns and the restrictions that are in place, we're experiencing a significant increase in mental health and addiction-related interactions. We have a lot of shelters very close by. There's about 15 shelters, homeless shelters, within walking distance of this mall. So they are in this mall daily. There's a very, very large increase in the level of aggressiveness from them and desperation from the homeless population as well. We've kind of predicted that to be their income opportunities have decreased. When there's no pandemic, there's a lot more people on the streets, and downtown Ottawa is very, very busy with foot traffic. They do a lot of panhandling. So that with the restrictions in place and the lockdown, there's less people on the sidewalk, considerably less people. So they're losing those income opportunities, and that's causing them to get desperate and a little more aggressive. We're predicting, I guess we're expecting, as the pandemic continues, these negative and aggressive interactions are going to continue to trend upwards. Since the pandemic started, there's been a decrease in the volume of calls, the number of calls that security here is getting, but the nature of the calls is getting more and more dangerous. So it's caused us to have a lot more caution when responding to things. And also the increase in PPE, the increase in precautionary measures going in, keeping your distance from people. All of this together combines a great scrutiny from the public. Okay, that makes a guard's stress level go up here. Some of the guards here, their stress level went up, and they started to begin to question their own performance. They started second guessing themselves. So with scrutiny from the public, that's just due to a gap in understanding of what security's role really is. There's been some unfair criticism because of that. And some of it has rolled in even this week here in this location. The criticisms that the public feels security should be enforcing the COVID restrictions. And as we all know, that's not security's function, more or less. I mean, they're wanting us to issue tickets, and that's something that security just does not have the ability to do. So as frontline essential employees, they're having to continue to come to work, continue to interact with the public while much of the population is at home. They're in lockdown, they're in restrictions, they're working from home. But yet, as we've already said, they're on the front line. Security's right in front with everybody while everybody else is at home. So that does increase and worsen the general anxiety that many people are experiencing, as does the rapid changes in policies, the overall uncertainty associated with the pandemic. One of the new challenges that we're now facing is there's been a very quick increase in the number of Canadians that are engaging with anti-government media, COVID denying movements like anti-mask groups, conspiracy theorists, because they're always around something like this, right-wing extremists. As those groups start to grow, they get more expressive in stating their cause and their beliefs. And we've now had a request from the guards, and we're sourcing it out. We're trying to find some training as to how to address and handle these types of groups. As a manager, for myself, it's given me two priorities. One is to be able to help our staff manage their stress and some of their fears. And number two would be recognition. We're trying to continuously recognize the guards for what they're doing, being out there, being on the front line, and in a lot of ways being the face of the company and the face of the mall. And it doesn't always have to be something materialistic. It doesn't always have to be a gift. A simple thank you to everybody at the end of the day goes a very, very long way with them. And we've noticed that brings the anxiety levels down. It brings the stress levels down a little bit. When they feel recognized and they feel they're important, that little thank you goes a long way. So we're continuously trying to find a win here is the best way to put it. It can be a struggle sometimes, but we do the best we can. So thanks, Glenn.
Thank you. So just a reminder, if people have any questions, please send them in. So the question that I have for you is that what are you hearing directly from your frontline staff about their biggest frustration during the pandemic?
I'll get going on that one. Just so everybody knows, we do have a combination of in-house security guards and contract security guards. They're all considered to be one team for us. The frustrations they're experiencing is the having to deal with the people in the public who are coming up and expecting them to enforce masks and enforce social distancing. There's a lot of fear around having to have those interactions in the first place because of the COVID, of course. So we've had to look at a lot of PPE, et cetera, to help protect the guards. Those are their biggest frustrations. I think there's starting to become a lot of COVID fatigue though, because a lot of guards are working a lot of hours. They're not complaining about it, but you do see it in their actions and how they're doing things. You're seeing people starting to struggle a lot more.
Okay, so I just want to say one thing for the audience about Parnell's use of the word guard. I know for some people out there that is it could almost be considered a derogatory term. We're both in Alberta, Parnell and I, and actually Alberta has created legislation when they updated their Security Guard and Private Investigators Act back in 2008, where the term security officer is actually not allowed. They've made it very clear. Now, I mean, I personally think that it's a bit of a red herring, this whole issue, security guard versus security officer. I don't think it's a derogatory term at all, but just out of habit, we're just we just regularly refer to them as guards. Personally, I think that should be a term of pride, but you know, if people are disappointed, I guess on one hand, I kind of see that as a bit of a tempest in a teapot, because I really think the industry's got bigger things to worry about whether they, it's a guard or an officer. But anyway, that's the terminology, and that's the usage, why we're using that term. So anyway, thank you for that, Parnell. And Jason, how about yourself? I know you did mention it, but like, what's the big frustration that your staff are dealing with? Do you think the number one frustration?
It's very, very similar to Parnell's. I mean, a lot of them are. I mean, the fatigue is starting to kick in. We were a little short-staffed here for a while, so there was a lot of overtime available. And I mean, guards always jump on overtime. Who doesn't jump on overtime? But the increase in hours, when it physically and mentally tires them out, but then the emotional level, the stress level does kind of go up. And the one term we hear all the time is COVID fatigue, but it is literally fatigue. So for us, it's just stay engaged with them, make sure everybody's, mentally they're still healthy. As people, that fatigue really kicks in. Sometimes the tempers can get shorter. So with their interactions, they really, control themselves a little bit more and pay a little more attention to that. But I mean, our problems, I don't want to say problems, our topics, I guess, are very, very similar to Parnell's.
Okay. Parnell, I guess this is for both of you. And as part of the training, I've heard you mention in the past the value of debriefs. Parnell, can you expand on that?
Yeah, we do debriefs for pretty much everything. Debriefs used to always be considered for major events like fires, fire alarms, bomb threats. We do debriefs for interactions that aren't comfortable. So we make sure the guards are provided an opportunity to sit as a team and discuss, okay, what went right, what went wrong on those interactions? How do we fix that moving forward? What might have worked, what might not have worked? And we do it for every one of our negative interactions, and the entire team does it just so that they can get the practice and walk it through in their head. And that way, when they do approach it, it comes out a little bit better. So we find that it's working really well and helping the guards gain some confidence.
So you've also mentioned too that the use of the development of scripts to assist.
Yes, and you are correct. We do have scripts for the masking and the social distancing. So if somebody comes in without a mask or people aren't social distancing, we have scripts that specifically the guards use to go in and politely ask people to put the mask on. If the person tells them to go away, we have a script in there that states, okay, thank you, and they walk away. They don't deal with it. We don't want to be enforcing it, but the public doesn't want us to address it. So that's how we do it, is we try to politely remind people if they don't want to listen to us, they don't listen to us. We're not enforcing our guards to have to go in and deal with that situation. So these scripts, they practice with them fairly regularly. They're trained on them, and they get to carry a little wallet card with them in their pocket as well, so it reminds them in case they're forgetting. So I have to assume that, I mean, by this point, people they've either made a conscious decision to either wear a mask or to not wear a mask. So how often do you think, in your opinion, when your staff are asking people to wear a mask, are they putting one on, or have they made that decision they're not going to wear it? You find some that are belligerent about it, but in most cases, people will usually do it. They just forgot to put it on. It's the occasional person that comes in. Usually they're going into a store and trying to create an issue so that they can have their stance known. But those people are few and far between. So we're finding most people are usually compliant.
All right. And Jason, how about yourself? What's the experience you have out in Ottawa?
It's similar. On the topic of debriefs, like Parnell said, we debrief just about everything right now, and it could be anywhere from a minute to a couple of minutes to, 10, 15, even longer if it's a major event. But as far as masks go, we've actually had people who come into the mall without one just to exercise as they say, exercise their right of not wearing one. They're just trying to make a statement, and they just try to walk around without one. Hey, look at me. I can break the restrictions. I can do what I choose to do. And similar thing, we don't use the scripts, but if we get the interaction where somebody is raising a stink, for lack of a better term, we just walk away. The last thing we need is for that interaction to escalate and end up on the 6 o'clock news, because everybody will pull out their cell phone and take a video of it, send it to media somewhere, and this was all over a mask and security overreacted. And but then people are criticizing us for not enforcing it. So it's a real fickle kind of thing. So it's just, if somebody refuses to, you just let them go. But like Parnell mentioned, we give the gentle reminder, and majority of the people, like people who have them hanging down here, they forget, they put it up, or some people don't have one. Every guard here carries a pack of masks with them. If somebody doesn't have one, they just, hey sir, can I offer you a mask? And people, oh sure, and then they take it. So we've gotten pretty good compliance, but we do get the odd one that comes in and just refuses to wear one.
Right. Are you are either of you finding anybody who are trying to set your guards up where they're deliberately, like they might, you know, there might be a second person with a video camera or with their phone out, and they're trying to capture that YouTube moment?
We've seen that in the retail environment where they're filming the clerks, but not so much for our security guards. We have seen those type of people, but it's more about filming on public property, and that's their big thing, is we watch security try and kick them out for filming on public property and film that interaction online. But yeah, we're not seeing a lot of it for our guards with masking or social distancing. And I mean, we're not giving them anything to film that's going to be good anyways. But if you go into a store and you agitate the clerks don't have the training that our guards do. So they're getting better reactions there. So you're finding most of it's going into like a Starbucks and trying to aggravate the clerks.
Jason, how about yourself?
Same thing here. We actually had one last week at the liquor store downstairs. And it was like Parnell said, some of the clerks they just don't have the training that security does. So you can always get that quick reaction out of a clerk, out of a cashier, something like that. But as far as setting them up, we haven't seen it yet. I better knock on wood so it doesn't happen. But we haven't seen it here yet.
Right. So Jason, you've also mentioned too that some of your staff have experienced assaults. And how are you dealing with that?
Now that was back, I mean, before Christmas. I mean, luckily, I'll knock on wood again. Luckily, haven't had one since then. But we had, I think it was 4 or 5 of them assaulted within a month. None of them were attributed to any of the COVID-related things. But it did cause us to take a look at, you know, is there an upwards trend here? Is there people legitimately coming in to do that? So we just case by case, each incident is debriefed and discussed. One of them was somebody who came down here with the intent to assault a security guard, but they were also one in a crowd of about 300 that we got swarmed here on Black Friday, and we needed some law enforcement assistance with that one. Others were just 2 or 3 of the others were just members of the homeless population who were under the influence of something and weren't really themselves, is the best way to put it, you know. But we haven't had any since then.
Right. So the flip side of this is, and I mean, we've talked obviously about the negative side and the impact with the restrictions and the mask enforcement and the stress. I'll start with Parnell. Can you talk about, has there anything so far that's positive that's come out of this, Parnell? There's growing recognition for the value that security personnel are bringing to the job, anything like that?
We're seeing more and more, and it's especially from the managers. We have to really sell up and explain what the guards do. So we're seeing a lot more recognition on the fact that they're being brought into meetings and fun events that we're doing, and it's all being done through Zoom, so the guards can actually participate from their control rooms. And so they're being brought in and feeling more like a part of the overall team and feeling like they belong. You're seeing more and more managers coming down because they are on the front line and getting to know the people and saying hi and thanking them and appreciating them. And you don't see that on a day-to-day basis when there is an event like this going on. So a lot of that's being recognized. Some of the stuff that we're dealing with, because you're seeing the increase in the violence from the vulnerable population and the numbers that are coming into the buildings because they have nowhere else to go. And so what they're dealing with is being recognized, and that's great news for us. It's going to be up to the managers to make sure that we keep pushing that moving forward. Right.
Jason, thoughts on that?
Very similar, again, very similar. Like Parnell had mentioned, he's got a hybrid of contract and in-house. We're 100% in-house staff here. And the managers here, the general manager, they're very, actually the entire office staff are very good at staying engaged with the guards. Everybody knows everybody here. Parnell had mentioned there, you know, they have some games in that to try and up morale and keep everybody involved. And when we're done here, I'm going to call Parnell and get some ideas off him of things that I can institute here. Staying engaged with them and, you know, letting them know, like I said earlier, letting them know that what they're doing is appreciated and is valued does go a long way.
Right. So you've both mentioned training. Are you finding that, like, have you suspended your general training? Have you increased it? Are you giving specific training to the guards to specifically deal with COVID related issues? Like how receptive are the frontline staff to training right now?
Well, the COVID training, a lot of it is related around PPE, how to direct people when they're coming into the building, how to stay apart from them. So it's pretty basic stuff. What we're having to deal with a lot more is because the vulnerable has become quite an issue, and they're becoming more threatening. We've had to spend a lot of time training them on how to deal with those situations. We have our homeless shelters here that do a course engaging vulnerable population, and we put all our guards through that. It helps them understand what the vulnerable population is experiencing. So it gives them a little more empathy when they're approaching those situations, but we have to spend a lot of time on that. As for other guard training, I mean, there's lots of opportunities right now for them, and a lot of it's online, and that's always been there. It's just now there's a more focus on it, and people are actually going and taking advantage of that. But other than that, things like first aid, we've been doing, but they're very small classes. Use of force, we have yet to figure out a way to get that done with a small class. So we're in the process of looking through that with our provider. So there is things that we're looking at to try and make sure our training keeps moving, because we don't know when this is going to end, and we can't wait 2-3 years to get use of force training up.
Right. Jason.
As far as use of force goes, we have the same frustration. Like I said, we just filled some open spots, and I've got 4 guards right now that are not handcuff certified. And as we all know, if you're not certified, you can't carry them. And then there's people that started mid-year last year that aren't handcuff trained. So we're running low, I guess, on people that are permitted to carry and use them. And trying to get that training right now is pretty much impossible. Our provider is just not doing those in-person and close contact training anymore. There's a lot of virtual learning that is happening from our training provider, but I mean, the use of force is the big one that we really need to find a way to get around that and get some of those certifications in place. De-escalation is a big one, and that kind of falls into these anti-mask movements and the conspiracists and things like that I had mentioned a few minutes ago. That falls under, it can fall under de-escalation. We're not going to find training that's specific just for people who deny COVID. So you kind of put it under that umbrella of de-escalation. But it's hard to get the in-person training. First aid, we just can't get it in town. Nobody will do, in-class first aid training here right now. So we're really struggling on that level.
Right. Okay. Just to let everybody know, it's 27 minutes after, so we're coming up to the conclusion of our first webinar. So crystal ball, tell me what do you think? More of the same over the next several months? How long do you see this happening, continuing on?
Well, based on the rollout of the vaccine, it sounds like here in Canada, for instance, we're not going to see most of the people starting vaccinations till November. So I suspect that you'll see this go into about mid-2022. And even then, who knows how far we're going to come out of it. So I don't know if we're going to go back to normal in 2022, but I suspect we'll be in this fully for all of 2021 in some way, shape, or form. I think things will ease up a little bit towards the end of the year, but to what extent right now, don't know.
All right. Jason, any thoughts on that?
I agree with Parnell on that this is going to carry through this year into next year. I mean, the crystal ball that normally sits right about here is out being polished this morning, so I don't have it with me. But long term, it is kind of difficult to predict as far as like restrictions and things like that go. You're mandated by the government, So we had a lockdown that came into place in Ontario for the entire province on Boxing Day. And then a week and a half ago, they put in a mandatory stay-at-home order, which I thought is the same as a lockdown, but apparently not. Apparently there's a difference between them. And that's because daily cases were starting to go up. And if they start to go down, they'll lift the restrictions, they go up, the restrictions come back. So we're kind of, I don't want to say limited to how the public responds, but in a way that's what it is. If the public does we all do our part and follow the restrictions. I mean, does that mean it's going to end sooner? I don't know. But as far as, trending cases and that, the government pretty much tells, especially a mall, the government tells us, how we respond to this.
Right. Okay. Well, we're coming up on the half hour, so I really appreciate both Parnell and Jason as panelists today. They're both experienced security practitioners with many years of experience and education in the industry. So appreciate your insight. So thank you both, gentlemen, for your time in this. So that brings our inaugural webinar to a close. So I just want to thank everybody for your attendance, and take care, and we will see you next month for our second webinar. So thank you. Take care, everybody. Have a great day. Bye.
Thank you.
Thank you.
Okay, I'm ending this, and I'm going to